Welcome back. This segment is sponsored by iChiro, Peak Performance Chiropractic. It may be time for an adjustment. Dr. Mike Kwast is here to talk with us about some of the research and what it's found when it comes to chiropractic care. Good morning. It's good to have you here.
Morning. Thanks.
Okay, chiropractic care. For people who don't understand, like, when should you consider seeing a chiropractor? What is the niche that you fill in healthcare?
Well, what people are aware of is really just pain. But really there's functional improvements that anybody could experience. Also showing by keeping your joints mobile and less tension in them, you have less arthritis and less problems. So really everybody should. People have less chance of going to a nursing home who are under chiropractic care. And then we've got some research showing some of the different things that people aren't even aware of, the benefits that they could be having. And that's what's kind of funny, because people always tell me, oh, it's too bad you don't have more research. And I go, we have a whole ton of research. Just because you haven't looked for it doesn't mean it's not there.
Yeah, well, let's us look for it, because we've got a couple of graphics we want you to talk us through. And this tells us sort of about the gist of it.
Yeah, this one's kind of cool. They did a 7-year study, and they just looked at people who went to the chiropractor as their first point of entry for seeing a doctor. So if you had a problem, you go to the chiropractor first. Not if you had your leg chopped off in an accident or something.
Right, we're talking pain or discomfort or the desire to stay mobile.
Yeah, and what they found were people had 85% less pharmaceutical costs, 62% fewer outpatient surgeries, 60% fewer hospital admissions, 59% fewer days in the hospital. And if you just ask anybody that, hey, anybody around, would you like any of this stuff? Most people go, yeah, I would take that all day.
Yeah.
If you ask our healthcare system, would you like to save this in cost? Most people say yeah, unless you're doing one of those things that there's less of.
Yeah, right. All right, let's look at the next graphic, please.
This one's interesting too. Just again showing that people who are under chiropractic care use about 53% less drugs. And that's a really big, important thing for people who don't want to take drugs.
What are you doing that allows the patient to avoid the use of drugs?
Most of the time what you see is people have the belief that taking a pill and is masking what they feel. They think it's actually fixing what's wrong. And so by actually changing the muscles and tissues, working on those, you can actually get that tissue to be healthy, work normal again, and restore function, which then it doesn't hurt anymore. So then they don't need to take anti-inflammatories. They don't need to take painkillers. People take Tylenol, Advil, ibuprofen. People
every day.
Every day for years and years and years. You know, and they don't even know the side effects and the risks of that. And most people, if you just ask them if you could do it naturally, would you prefer that? And I find most people go, yeah, I would. They just simply don't know what to do.
All right, next graphic, please.
This one was interesting too. Basically, if you had a work comp injury and you went to a surgeon or a medical doctor, you were 42.7% likely that you were going to need a surgery. And if you went to the chiropractor first, it was only 1.5. So that right there is going to save money. It's going to save suffering. Surgeries are risky and often needed, but they should be a last resort. And that's unfortunately just not what we see. We see tons of patients who come after they've had 2 or 3 surgeries, and then we get them better, and they're like, wow, I guess I should have done this first. And it's like, yeah, you really should have. It's just, again, they just didn't know or didn't understand it well enough to make an informed choice. Okay,
and then our final graphic is a graph. What is this showing us?
This one's interesting. It was done over in the UK, and they were just looking at different things like adjustments or manipulation with exercise, manipulation, exercise. And then here's what's kind of funny to me. They called the standard medical care, meaning going to your medical doctor and taking drugs and getting advice, they named that best care. And then when you, no bias there, right? So then when you look at the actual results of the study, it shows that the people who did the manipulation with exercise got the best results. The next one was manipulation. The next level of results was exercise. And then what they had called best care actually had little to no results at all.
Wow.
So it's kind of funny, because if I were to just ask the public, what do you think the best thing to do is? They'd say, go to my doctor and get pills. And it's actually, that's not what the research shows at all. And so my kind of interesting thing I see all the time is people say that literally on a daily basis, and then they even expect their doctor to know. But I mean, who has time to keep up with every research thing, especially when it's not in your field? So we're trying to get this information out there so people can be educated, so we can save costs, so we can not see people suffer with problems that they didn't need to. But again, it's just educating the public, and because we don't have a drug company behind us or somebody that's pushing all these things, you don't get the advertising, you don't get the information out.
All right, well, we want to let you know, iChiro Peak Performance Chiropractic has 2 Grand Rapids locations, one on the East Belt Line and one on Kalamazoo. The information is available on our website. Good to have you here.
Hey, thank you.